Good morning, everybody. Welcome to the Paradigm Shift. Today is World Cancer Day, and today we're joined by two of my very dear friends, Anita and Yashpal. They're both cancer survivors, and they're here to talk about their journeys, their stories about their fight with cancer. Appreciate it, guys. Thank you so much for doing this.
Thank you for having us.
Anita, Dr. Anita, she's an ENT surgeon turned cancer and sleep coach. Anita.
Hi, everyone. I don't know if cancer is something which we should be celebrating or, yeah, but I'm very happy for whoever's over here. And I think for the first time, I think I'm actually talking to Yashpal, who was a senior in our school. And it's kind of really under weird circumstances that we are meeting. But yeah, it is what it is. So thank you for doing this, Shiku. And I'm looking forward to the next, I don't know, half odd hour.
1 hour.
Yeah, thank you.
And we have Yashpal Singh Chauhan, who is a property developer turned organic farmer. Hi, Yashpal. How are we doing this morning?
Hello, I'm very well, Shiko. How are you, Dr. Anita and Shiko?
All good.
All good.
So I think let's go straight into it. There is Sapna who says, "Hello, guys. Hi, Sapna. How are you?" And Sapna is doing some amazing job with kids affected with cancer. Sapna, I want you guys on the paradigm shift very soon. Ashwini, hi. Hi, dears. Where these are some of the people who could join us this morning. Everybody else said they're going to watch the recording. Okay. So let's get straight into it. Anita, tell us that day when you thought that something was off. How was it that particular day?
It's quite interesting because I think it was roughly around this time a year ago when I could, feel the lump. And I think I was one of the luckier people because
Yeah.
it was at a place where I could like pretty much, feel it right away. And being a doctor for all these years, it definitely made it a little bit more easier to know what could be the likely cause. So yeah, it was roughly around this time. I know exactly what day I was diagnosed. Um, and I remember the general practitioner over here. So here the system is a little bit different. You need to go through a GP, and then they would refer you, if necessary, to a specialist. And she was very nice about it. And she said, "Oh well, it could just be, just a small swelling or something like that." And I nodded and she nodded. But I think the only one who really understood, or I mean, the only person who didn't understand in the room was my husband because, he's not a medical person as well. And obviously, he was just being very optimistic about it. But it was just at the start of around COVID as well, around that time. COVID was just something new that we were just beginning to, get to know. And I got diagnosed within about a week, which was actually really, really, really good. Um, I knew it. I just knew it. I realized I've always felt that I've been an intuitive person, but this was like the ultimate thing. So I just knew that this was something just different. And then a lot of other things make a lot of sense. I don't know if Yashpal had something similar, but you over a while you have been having kind of really, you tend to get very tired. There's just something off about the body, but you just don't know how to really kind of pinpoint it. And for me, I think when the cancer actually manifests or shows up in whatever form, it's almost like the body is getting ready to get rid of it because we've already been suffering, I think, for quite a while. Again, I don't know how what Yashpal has to say about it. What do you think, Yashpal?
Yeah, I agree. In fact, it's what a coincidence. Some of the things you have mentioned are what my incident episode was way back in between 97 and 2001. So, by the grace of the Almighty, I have been off any sort of medications. My last chemotherapy, I recollect, was 16th of Feb 2001. And I have been better. But yes, the like you said, being intuitive, I had a premonition exactly a year before I was diagnosed. It was in 1996 when I had actually spoken about it to my family that I think I'm heading for a very, very major illness. And but none of the symptoms that you mentioned, being tired and all that, occurred to me. It just manifested itself. It just came. I mean, 97 just erupted, and 20 days it took its toll. So that's my experience being diagnosed with it. Yes, Chiku.
So basically, the thing is, why I asked you guys this question is like, how was the day and how did you get diagnosed? Is because we often hear people going to the hospital when it's almost the third stage and fourth stage, which is super scary. So you guys have been lucky that this got diagnosed in very early, and that is good. So what are the symptoms really? Could you like you said tiredness or something? So what are the other symptoms that one feels? If you could explain to our viewers.
Yeah, so for me, I mean, obviously it depends on which part of the body is
Yeah,
involved. Obviously, there's
yeah,
no doubt about it. It's usually like maybe a swelling, or again, I'm going to stick to maybe at this part of it. I'll just stick to the breast cancer because that's what I had, and also because that is the commonest cancer among women. So typically, luckily, they are in certain countries they have screening programs where after the age of 40 or 45 you've got to go in for your yearly mammogram. More so if you have a family history and you have so-called high risk factors. But having said that, the high risk factors doesn't really count so much because somebody who may never have any family history or any of the high risk factors, like I'm a classic example, I didn't have any of those risk factors. But it can happen. So it just doesn't mean that if there's nobody in the family and if you've been like, eating healthy and kind of just having whatever, what was supposed to be the vices, it doesn't mean that you're kind of immune to this illness. So that is something I think which is really important for everyone to know. And as far as the symptoms is concerned, is as I said, it's a very general thing, but I really believe, like the way Yashpal said as well, um, we in some way have to really listen to our body every day. Like I think that's one of the practices which I think would really go a long way. And the body is always trying to talk to us and give us small signs and signals. And anytime you begin to feel that there's something that's off, there's something that's just different, I think it's a good idea to just try and get it tested because you never really know what's going on. Um,
right.
yeah, yeah.
Jaspal?
Incidentally, Shikho, as I reminisce, early 96, I had an infection in the groin area, lymph node, an infection in the limbs. So we had it operated and sent it for biopsy. It just came nothing. Then that infection, basically, Dr. Anita would agree with me. I think they are those, what are they? The distilleries, the lymph nodes, they cleanse the system, I believe. So then it traveled to my upper armpit. Again, I got operated after 3 months. Again, it was benign. There was no malignancy there. But then in 97, suddenly I had high grade fever, and which was not diagnosed as being malaria or infection. And then suddenly, my lower part of the body, I lost mobility because generally the blood cancer starts in the bone marrow. So my pelvic region was totally immobilized and excruciating pain. And so I took a neighbor's help and asked him to take me to the local hospital, Bailalamin. And being fit, being into sport and all that, even the doctors did not lend it much. And so in 97, kidney cancer was in a nascent stage in India at that time. So they did not suspect any sort of malignancy and they went through a number of tests. It was only after 20 days that they decided to move me to Cancer Hospital, Ahmedabad, where they took bone marrow samples, and that's how it was diagnosed.
Okay. So now that you guys have said about cancer and being diagnosed, tell us how did cancer change your life around it, like mentally, physically, how did it change? Anita?
Uh,
Well, I think the best way of summing it up is like I really feel like the last year has really been kind of a crash course in life. I think what I learned in the past year, maybe I haven't learned it. I've learned it in little bits of pieces over like 47 years. But oh boy, yeah. So it really, 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 really has changed a lot. Um, People say, all right, you're done with treatment, and now you should be back to your normal self. I That never happens, and as a cancer survivor, I think that's one thing which we don't want to hear. We can't go back to that same normal, and we don't want to go back to that same normal, even though we may not really be so responsible for the cancer. But definitely, we ourselves know that there is something that we want to change. Not that we have to change, but we want to change. Um,
Right.
and yeah, I mean, I think at the end of the day, for me, if it, you kind of go through that phase, and I still consider myself that I'm still kind of, in a way, still healing. Um, it takes its time. I think there has to
Yeah.
be a little bit of kind of a mourning period, if that's right, if that's the right word to use. Because if not, we are very, very used to like saying, all right, done with treatment, all right, let's get back to work, let's go back to
Yeah.
normal, all of that. But I think it does take its toll if you don't give it enough time to really thinking about the immensity of what's actually happening to your body.
Right.
Um,
Right.
and that's where I come from. So yeah, I'm it's been good. I have got getting my priorities a little bit right now.
Yeah.
Know where to invest my energies and where not to. And every day I make it a point to enjoy and do something that I really, really, really enjoy. Which honestly, I don't think I was doing much before because everybody else and everything else is more important. So I think
Yeah.
that would be like maybe one of the biggest lessons that I have and I continue to learn and work on.
Yashpal, you, how did cancer change
Deepshika,
people?
are you typing while Anita was speaking?
No, I'm not typing. That's what I was thinking. One of you guys is typing. Who's typing?
No. Oh, I wonder who is. Oh,
I
the
have.
doctor is the culprit. Doctor, stop
I'm
being
just
naughty. All right.
okay.
So, uh, you know, if I am to look back on it, even then, my first thought that when they said you have what you have, so that's fine. So I asked him. I had responsibilities. I was just married 6 months, and my wife was pregnant 3 months. So you can imagine, the responsibility of having a newlywed wife and a child coming up in another 6 months. So how do you reconcile to it? That's the first thing. You have elderly parents at home also. Uh, that's the time you begin on a long journey of self-discovery, being more responsible for your own self.
Yeah.
You do
Yes.
realize that it's all upon you. This is just the beginning of the journey, a long, dark, sometimes lonely, sometimes frightful journey. You
Yeah.
have to dig within you, deep within you. Believe me, you cannot imagine the kind of reserves that we have, that we are blessed with. Every individual, when he faces adversity, believe you me, we have the reserves and the strength with us. So that's how I approached it. I said, okay, so there's nothing I can do but help myself, take
Yeah.
responsibility for myself. Be the Another thing is be very, very cooperative with the doctors. Don't whine, don't complain.
Yeah.
They are doing their best. They are equally on a sticky wicket as you are. They are the ones who wish well for you. Build up your strength mentally, build up your strength emotionally. Because cancer induces the worst of emotions within you, and the chemotherapy is the worst thing that does it. And since I
Oh,
underwent chemotherapy for 3.5 years, um, you just have to associate person at that time, and you have wild fluctuations of emotions, anxiety, desperation. So you go through it, but yes, believe you me, having cancer was a blessing. It was a man life changing experience, and it was a man making experience as well. Uh, it was a beautiful moment, those 3.5 years. It is a road to self discovery. You do things that you like doing. Tomorrow is maybe not, you may be not be responding well to treatment. Maybe it's not. So today is a good day, so
Right.
enjoy the day today. That is it.
Right.
So you start
Right.
learning to live in the moment. You start appreciating people around you, the efforts that they put. And you know, Shiku, the worst part is it is not your pain, but the pain of those people around you who are at more pain because they are helpless. They cannot do anything for you but wish you
Right.
well. So you look after them, be good, be nice, start appreciating life. And like I said, it's a new journey thereafter. Having cancer is a blessing. It's been the most positive thing that has happened to me.
Crazy. So that was so well put, Yashpal and Anita, because that is what, like when you have a disease and then you suddenly kind of wake up and you say, okay, I have to do this right. And like you said, I have to live this day. And there is too much disturbance, right? There is, there is typing. Nobody is, no, none of us are typing and still there is
None
this noise.
In fact, I'll interject here. Chiku, one of the experiences I often had during those 2.5, 3 years is you wake up in the middle of the night and you say, okay, this diagnosis is just a nightmare, and when I wake up, I'll be fine.
Oh,
Did that happen to
understood.
you, Anita?
Absolutely, absolutely.
Yeah.
Sometimes yeah, you just wonder like, am I like dreaming about all of this? Is this really for real? And
Yes.
Yeah,
gosh, Yashpal, I absolutely loved what you shared, um, because honestly, it's kind of reassuring when you hear somebody else also has gone through a
yeah,
similar journey, irrespective of what gender we may be, at what stage in life we may be, what age we are.
right,
I love the sentence that you made about it having been a blessing. I think that
right,
alone speaks volumes about how you have processed it.
right.
That's beautiful. Yeah.
Absolutely. So tell us, Anita, how many months, like what was the plan of action once you were diagnosed? How many months of treatment and how long did it take for you to get cancer free?
So mine was quite. So for breast cancer, what's different compared to other cancers is that typically for cancers, you either have a choice of surgery and then radiation and then chemotherapy. In breast cancer, what's additional is because if it is something that is sensitive to our hormones, estrogen and progesterone, then they have to give something that's going to kill off those hormones as well to reduce the chances of the cancer coming back because the cancer is basically feeding off those hormones. So they
Okay,
continue on what's called a hormonal therapy, where you
right.
are kind of you're made to be, you're kind of literally pushed into menopause, and it's a steep push.
Oh my God.
So for me, I didn't require chemotherapy because I got the test done and everything, and there was no need, there wasn't any much benefit for chemo. So
Mm-hmm.
I had surgery and then I had radiation, and then right now I'm on hormonal therapy. So the main
Okay,
treatment part of it got over in about 3 months from the date of diagnosis to completing my radiation. Um, and then the hormonal therapy goes on for at least a good 5 to 10 years.
oh, okay.
Yeah, yeah.
So you're on a long journey, Anita.
Yeah, but I actually like it. Okay,
It's a
maybe I
good
shouldn't have
journey.
said like it, but
No,
I
it's
mean,
fine.
the
That's the way
tablet, it's in a
you
tablet
you,
form.
you accept it as your life partner, don't you?
It's a
Yeah, it can't
tablet
be worse
form.
than marriage, anyways.
Yeah, it's a tablet form, and it's kind of every time you take the tablet, it's almost like it's a little bit more of a reminder that, oh yeah, all right, I had cancer. It's also really funny, when you tell you have cancer versus when you say you had cancer. Versus saying I'm a cancer survivor versus saying I'm a cancer thriver. Things like that. So there's just so much that kind of goes on. But
Right.
yeah, that's what it is for me. And then yeah, of course, the yearly follow-ups and um, dealing with menopause can be another full 1 hour where maybe Yashpal doesn't want to be part of it.
Why he has a wife? I'm sure
That's
he would
right.
love to be a part of this. Tell me more.
Yeah, yeah. Fortunately, I'm scared of it at the moment, the wild mood fluctuations of a wife in menopause. So, incidentally, Deepshika, I just recollect something. Every human being has tumor blast cells within them. Are you aware of that?
Yes, yes.
And it is acceptable if it is below 5%. When the correct me if I'm wrong, Dr. Anil, when the cells start mutating, the rogue cells are developing, is when the tumor blast cells multiply.
Okay,
And so that is a particular feature of cancer, which most
right.
of us, I became aware. And the funny part is when I grew up, I used to read Reader's Digest. So you
Okay,
would read about drama in real life, and
okay.
all these episodes and accidents and cancer. Till you don't have any of this, you feel it happens to other people. हमें नहीं
Yeah,
होता. It cannot
correct.
happen to us. So it is an experience when you become a part of that story, when you have a drama in real life yourself, and then how you
Right.
deal with it's entirely up to you. What the doctors can do is counsel you, administer medicines, attend to emergencies, but your battle with malignancy of any sort is your entirely your own. You decide, everybody has to go. It is on to you to decide and resolve whether I want to go smiling or whether I want to whether I want to go smiling or live with a smile with it, live with it. Or I want to crib about it. The choice is the individual's.
So true. That is brilliant. So I want to know when you guys, were diagnosed with cancer, what were the lifestyle changes that you guys made? I mean, did you start eating right? Or, I mean, I'm sure you guys eat right, but did you guys, because we'll come to that later, but like, they say that food cures everything and food heals everything. So did you guys have a major lifestyle change?
um, yes, definitely, definitely. I always was quite careful about my food. I was the only one at home who didn't have the KFC or the McDonald's and things like that. But that was for
Okay.
like different health problems that I had. But what happened here was I just became really so much more particular about everything that I was feeding my body, my mind, and my spirit. Because I think, like the way Yashpal said, um, the doctors will obviously give it the best shot, but I think the real strength and the power is what you do between your doctor's appointments, and that is completely in your
Yeah.
hands. Which is why I think even if two people have had the same amount of treatment, the same type of treatment from the same diagnosis, somebody may do so much more better than the other because it's pretty simple. What you are feeding your body is what's going to show out. And so, yeah, food definitely helps. But as I said, I think it also, you got to really literally like deep cleanse your life, you
Yeah.
know?
Yeah.
And I think it's like really a wake up call. And to be really honest, at that stage, you just don't want to leave anything unturned just to get the doctor to tell you, all right, they may most likely never say that you've been cured of your cancer. But what they can say is that there's no evidence of
You are
disease
free for
or
the
you
moment.
are in remission, you know?
Mm.
And so at that point, you just want to do everything possible. So, yeah, I mean, I went completely vegetarian. I stopped drinking alcohol completely, which was difficult when you move to New Zealand and you get alcohol cheaper than water. So that was very interesting. And
Right.
I started juicing. The other thing I made sure was I used to get my exercise. So luckily, even though it was like right in the midst of COVID, as I said, I've considered myself so lucky in so many ways, and I definitely know one part of it was the fact that I am in New Zealand through all of this. And even when it was like really complete lockdown here, we were allowed to go for walks just round the block. So at least I used to get my 20-minute walk. And exercise now is proven to really reduce the chances of the cancer coming back, and all the fatigue and bone loss and anxiety, depression, everything that comes. And that's all part and parcel of cancer, to be honest. I don't think there's anybody who will say it didn't affect their life at all. It affects you in every possible way. So exercise was the other thing, and of course my baby is of course sleep, because sleep is really not mentioned much, but it is so important, because your body is really healing when you're sleeping, and
Right.
your sleep is definitely going to go for a huge dive. But we do need to address it as important, if not more importantly, compared to your diet and your exercise and everything else. So the meditation and the yoga and everything, all of that was part of it. It was just like whatever I
Okay.
felt like in a day. I had this whole menu in front of me, and I was like, all right, today I don't feel like sitting down. I want to do some yoga instead. And you just kind of start learning to love yourself a little bit more and really listening to what your body feels like at that time. Because hey, you only have cancer. Like how more terrible can it get? But yeah.
Oh my God. Yeah. Yashpal?
When we grew up, if you would recollect in the 90s, the maximum indulgence that we had was samosas in school. We
Yes.
had no KFC, we had no McDonald's, we had no pizza. The favorite haunt where we could have pasta or spaghetti was Kalyan Cafe. And eating out was kind of a taboo in those days.
Yes.
Kind of. I mean, and we had limited pocket money. So
Right.
food dietary habits were quite clean but then the funny part is when you're undergoing chemotherapy and the radiation, food is the least thing on your mind because you can't eat. Even the smell of food turns you off and you start puking. So in
Oh,
my case, I would have, I would say, okay, I want to have because it did not emanate any kind of a smell or an aroma. So that was it. If they make pastas I would find very, they put me off and I puke. So there would be 2 or 3 meals that would be cooked at one time. Okay, if it's not pasta, then it is it. But you have to feed your body any which ways. Try and
right.
keep more of protein intake. It helps the body, yes. Anita, in India, hygiene is a big issue. Um, when I realized, I mean, abroad, when you have chemotherapy, your immunity system is suppressed. So you're kept in the hospital for a few days till you recover from chemo. In India, there's no such facility. Then, I don't know what it is now, but between 97 and 2001, I used to travel to Ahmedabad, stay there from Monday until Friday. And incidentally, I ran into one Damle from New York Cancer Hospital, and she was shocked. She said, after chemotherapy, how did they allow you to travel? So that is, you have to be very careful about uh, catching any sort of infection. It could be tuberculosis because each time you have any sort of an episode of catching an infection, they have to postpone your chemotherapy and
Oh,
treat you for what you have. So in my
oh,
case, yes, exercise was minimal. This is just walking about in the compound of the house. You have to be made, just as it is with masks now, with COVID, is how you protect yourself in India while you are dealing with cancer. At the present, at the moment, I don't know since 2001.
okay. That's very well put. That was going to be my next question. So I wanted to know, Yashpal, from your time that you had cancer, that was 1996 up until now. I think both of
1997 to
you
2001.
one. So, have there been any paradigm shift in terms of cancer? So, like I could say, more acceptance, more inclusive, more hygiene, uh, more therapies, more treatments. Tell us if you guys know, because I'm sure you guys are part of, big cancer groups where you are constantly, helping other people, inspiring other people, motivating other people to get through this dreaded disease. So, have you seen any paradigm shift? Anita, you want to
Doctor, you want
go?
to take that?
Yes,
Yeah,
sir.
sure. So I think my relation with cancer started way before I became a patient, because even when I was practicing in Malaysia as a surgeon, there were a lot of cancer patients over there, and where the hospital that I used to serve in was a government hospital where it was the whole, all the people who were diagnosed with cancer and who needed radiation had to be admitted in our wards because it was the only hospital throughout the state which had radiotherapy. And there used to be times where the entire ward would just be patients who are going every day for radiation. And there was a time when we had to mix chemotherapy ourselves and administer it to the patients as well. Uh,
Oh,
because, over the weekends the pharmacy would be closed. And this is like Malaysia, which I think is, it was a real eye opener in a different way. The type of side effects you see, and when it's ear, nose, and throat, you're talking about the head and neck area. So they can't eat, they can't breathe. Um, the hearing gets totally, sorry, rotten. Um, it's not a very, it's not very pleasurable. So it all started with that, and there's been a lot of progress, no doubt about it. But sadly, the reality is that no matter whichever country, so from India, then Malaysia, then New Zealand, the reality is that cancer is still a pretty expensive disease, and no matter where you are, to get the so-called updated treatments, whatever it may be, you still have to pay for it. You know,
yeah,
and this is kind of almost a blanket rule wherever we have been, and that's really sad. That is really really sad. And we're not talking about cheap drugs. And like the way Yashpal said, it's not something that you just do for a week and you're done with it. It goes on for a fair amount of time.
yeah.
So yes, no doubt there's been a lot of advances. The advantage of having a cancer which is common, like breast cancer, is that there's a lot of research that's gone into it. But the ones who who have like the really rare ones, they still are going for treatment, hoping that it's going to help. Forget about getting cured. So
Oh
there
my
is
God.
just so much more that goes, and that's where all the kind of ugliness of the pharmaceutical companies come in. Where research goes in and things like that. And it's sad. It's really sad that something like cancer also gets affected in this way. So yeah, there have been a lot of advances, no doubt about it, Hiku, but there's a long way to go. Like a really, really, really long way to go.
Right.
Yeah.
Yashpal?
Instantly, Deepshika, between 2001, what I've observed is medical practices have improved, hygiene levels have improved in hospitals. There are more oncologists accessible. Like when I was diagnosed, I had to have my bone marrow tested in Ahmedabad Cancer Hospital, probably because there's only facility. Now we have multiple doctors, specialists, different this thing, and who I can attend or any cancer patient can go to in Baroda. Availability is drugs. Then, to avail of any particular drug, either you had to request somebody from abroad or seek for it from pharma company and either get it from Mumbai. So that
Hmm.
has been, there's more awareness about cancer. Another thing is the perception of cancer. Earlier, in a local language, cancer is cancer. So it was assumed that it was the death knell for you. But it's not so. It's not so. It's also a fact that there is no cure for cancer. You can be cured, but no doctor will be able to tell you, yes, I've taken these paracetamol tablets and I'll get off, say, an infection, a viral fever, or medicine for malaria. You have to deal with it. You have to accept that as a reality and then embark on this journey. But yes, hygiene practice, accessibility to good doctors, and good medicines are available, good facilities. Like radiations now, which is a mighty expensive thing, they are available in Baroda also.
Cool. This is one question for both of you from a feminine point of view and a masculine point of view. Is telling people that you have cancer a taboo, or I mean, did you protect that information till you were comfortable? Tell me.
Can you come again, please?
were you, I mean, you had cancer. I mean, did you have to protect
Yes.
that information from telling people that you had cancer? I mean, was telling people a taboo, or, did you face that?
Oh, very incident. I'm a businessman. I'm a builder by profession. And if you tell anybody that you have just come or recovered from chemotherapy and cancer, initially I would find people not wanting to buy apartments in a building. They would say, Dobara, if he gets it again, our money is going to sink, whether he'll be able to finish the project. It happened with me in the initial phase when I began my work in 2001. But yes, it's a fact. But yes, speaking about cancer is a moral responsibility for anybody who has gone through this experience. It's like, I would equate it to Rishi Munis who discovered the ultimate truth of life. And then they don't sit in the Himalayas, say Raman Maharshi, Ramakrishna Paramas, Vivekanand. You assume that form and you speak about it. You have to, it's your duty because you are blessed with something that you have it 99% of the people don't have it. Speak about it. It is going to help somebody. My experience
Right.
is sharing it. I've had people, and the best part about having cancer, that is my earning, which I feel, oh wow, this is my true earning is the pediatric wards. You cannot imagine the children having cancer. And Ahmedabad Cancer Hospital, I was treated in the pediatric ward, and I had the opportunity to look at these kids. And then you have the opportunity to speak to people, especially the parents. So when you walk into a room, say with 20 parents, and you look at the faces, and then after you've spoken to them for about 15 minutes, 20 minutes, and you see the charm and the glow on their face and the sense of hope that nothing is lost, you receive blessings in turn. I've had parents of kids hug, cry, bless. It's an experience. So you must speak about cancer.
Right. Anita?
I love what Yashpal said.
Yeah.
Having said that, I think it's a phase, and I think it really brings out what's really important to you. So, for my own personal self, when I was really going through the journey, I was very careful about whom I mentioned it to and whom I didn't. But I think the main reason for me was because of fear of people who are really important to me getting to know about it and how they would be able to handle it. Uh, so it was really coming from that place. And
Yes.
also because it's interesting because as soon as you kind of tell people that you've had cancer, um, there seems to be this almost like a hush in the room, you know? And people, I mean, no matter what it is, like I've written that, I've written my story in the book,
Yeah.
right? And so quite a few people have read it. And you would expect, like, all right, they're going to come back to you and maybe tell anything about it. And people have just gone silent because we just are never equipped of how, like, what do we say, you know? And I completely get it because even I'm sure even I would have been there at some point. So I agree with Yashpal that it is important, mainly for the reason that the way you had mentioned earlier, cancer doesn't mean it's a death sentence. Um, you can die from a whole lot of other reasons as well, premature. And don't
Right.
just, as soon as someone says they've had cancer or they've been diagnosed with cancer, it doesn't mean that that's it. And I think that's one
Yeah.
of the main reasons why I'm so happy that we're actually doing this to show people that, we just look like normal. Not every cancer person has to look like, you know what I mean, right?
Yeah. Yeah.
It's an effort, no doubt about it, but it's important to give that hope because I think the hope goes really, really a long way. It
Yeah.
really goes a long way between before, with of how it's going to come out, and yeah, it's why would
Yeah.
you want to keep it private? Like, why would you want to keep it private?
Correct. That
Yeah.
is so true.
Like
Okay.
when you said Anita, it's like that judge sentencing you to death in the courtroom. That's the hush you are speaking about. And everybody falls silent.
Yeah.
Yeah.
And when you speak about it, other people have a different perception. Quite literally, they lose hope for you. But you have to give yourself hope that no, you can't have other people's perception, sympathy, their sense of it being so morose. You can't. You have to, for your own self, you have to buck up, tighten your seatbelt, go in for the rough ride, take it in your stride, enjoy the journey. It's a journey, and you enjoy it, and you discover so many aspects about your life that
Yeah,
you are, when you emerge, you are a very different person in terms of having had very different. And it's a blessing. I mean, I used to tell my oncologist, I said, Asha ma'am, I'm so lucky. She said, why? Oh, I said, I could have died in an accident. So I have a second chance at life. So I'm happy that it's just cancer. And
right.
she still remembers me for that. God bless her. So she just retired now from cancer hospital, and now she's taken to spiritual life. She's become a kind of a sannyasi. And
Okay.
I make it a point to speak to her. And you know what? Believe you me, your journey through chemotherapy builds wonderful relationships with your doctors. They are actually willing you on, wishing you well. Any drop in the response to chemotherapy, and if then they see your bone marrow report or blood report, you can see it on the face that they were hoping for it not to be this. I
Wow.
had a incident when my doctor, when post chemotherapy in the last phase of my chemo, there were little boils in the armpit, and they took a fine needle aspiration, a FNFC. And you should have seen the lady's face. And when the FNFC report came, it was just a minor local infection. And she had tears in her eyes. She said, yes, I'm so happy it's just that. You cannot imagine how many people are behind you, wishing you,
Wow.
willing you on. And that's, you cannot describe the gratitude, that connection that you have with your doctor. But you can remember that occasions like this, and hopefully in the universe she'll be blessed.
Right. That is so beautiful. So beautiful. Anita, you are post your cancer, you are helping people with, you are now a sleep and cancer coach. Let's talk about that.
Yeah, sure. Shruti, before that, I think we've got a lot of our common friends who are like sending
Yeah,
messages.
yeah.
So thanks to everyone, Ivi and Sapna and Ashwini and
Good to see you.
Survi. Yeah. Thanks for being here and, just listening to us. I'm sorry, I don't know if I missed anybody else,
Yeah.
but yeah. Sorry. Oh, yeah. Okay. The cancer coach part of it. Sorry. What was your question, Shitu? I'm so sorry.
I said you are now, we're all getting old. Okay, so I was saying that you are now a sleep and cancer coach. So tell us about that and like how do you help people and what are
Yeah.
these coaching all about?
Yeah. So it's interesting because when I moved to New Zealand as just sort of like kind of almost a passion, I also did my life coaching. So I did it, you know, just as a part time kind of a thing. It was really fun. I really liked it. And before that, I think even before I became a patient myself, um, I started believing a lot in the sorry, Daisy, no, we love you too. Oops. Sorry, where was I?
This is the identity crisis, is it?
I,
Has to be
I
so
know,
difficult.
you don't want to cross the line. You don't want to cross their paths. The convent of Jesus and Mary girls. Never, never. Yeah, sorry. So coming back to the coaching part.
Mhm.
Yeah, and I think I started really kind of believing in the whole mind-body connection. For a really long time as part of being when I was a doctor and everything as well. So I started kind of looking into the whole holistic and the whole connection thing. And the life coaching thing came across because I myself used to get a little bit coached and I used to just find it absolutely amazing. And so basically what happened is, you know, I moved here and then there was a lot of stuff that was going on. And then I ended up having the illness as well. And I mean, I just realized that, as I mentioned earlier, I think the real transformation really happens in between your appointments, in between your chemotherapy, what you can
So
actually
right.
do. I think the other thing, like what we've already touched earlier, is the mindset. You know, as soon as someone knows that you've got cancer, it's almost like, oh yeah. I mean, usually people will say, yeah, we know somebody else as well, but she did very well. No one's going to say, yeah, we know someone and she kind of,
Yeah.
performed. But typically, ourselves, the first thing we would remember is typically the person who has not done so well as a result of cancer.
Right.
And
Right.
at that time itself, you're already almost creating your story,
Yeah.
you know. Um, and so that's the whole thing about the coaching part of it. It's really about telling them or rather showing them and saying, listen, just because you've got cancer, it doesn't mean it's the end of it all.
Right.
The other thing, what I really kind of really focus on, of course, is because of all sleep has always been something of an
Yeah.
academic interest for me. I've done
Mm.
research, all of that, and I do realize, having lived it myself, and even having for a time having to resort to even taking sleeping tablets, simply because I knew I needed that rest for turning up even for radiation or even for surgery. Sleep became really my forte because I really know the science behind it, and we can't conveniently blame all sleep problems only on cancer. You may already be having something even before that, which is got separated. So it's all
Right.
kind of, incorporating all my years of experience along with the coaching. And as I mentioned, I think sleep is really the foundation of everything. If you haven't had a proper sleep, it's going to be difficult for you to go for that walk. It's going to be difficult for you to cook. It's going to be difficult for you to make your own juice, whatever it is. So I
Yeah.
think sleep is
Yeah.
really a foundation that not many people really address.
Right.
And so that's where it really is. It's really about like having, literally holding the person's hand in a way and saying, you can do it, you can do it. It's like a cheerleader in a different way. And having been through the journey myself, having been a doctor myself, having operated, I've even been a caregiver for someone who's had, a brain tumor. I've seen it like from so many angles. Um, I really feel like it's really like, I mean, I know this sounds very cliche, but I really feel like it all has happened for a good reason. Like it feels like everything is kind of narrowing down now and making sense. And I'm
So
just
good.
loving it. I'm just loving it every moment. Yeah. So
So
that's
good.
how it
So good.
happened.
Yeah. So we will put your details along with this video so that if there are any people that want to contact you, because now with the pandemic, everything is online, so they can talk to you online and then they can get in touch with you for further details and all sorts of things. Sejal says, thank you, Yashpal and Anita, for opening and openly sharing your journey. That is so sweet.
Because I
So,
also want to mention, if there are anybody over here who just wants to have a kind of a shift in their lifestyle. It doesn't necessarily have to be cancer related. There may be people over here who are taking care of someone who's had cancer or who has
yeah,
had a relative who's had cancer and who may be saying, oh my God, am I next? Which is normal.
yeah,
Um, but you can actually start changing that story so that it may never happen. Or even if it was to happen, you may be already equipped with a lot of other tools. So I have, I mean, if that's okay, I have a course or a link that I could share with
sure,
people. They could start following me maybe on Instagram. And if they
yes,
send me a message, then I would be more than happy to do it. It's a self-paced online, it's free. And it's
right,
really about changing a lot of things in your lifestyle, which is going to help, because cancer also is a chronic illness. So it doesn't have to be only for cancer. It's really about cleaning up your life in whatever way you can. So I think that
right.
is another thing as well, which I think would really go a long way.
That is amazing.
Yeah.
So just
Actually,
before you
Anita,
guys,
I said sorry, we
so
had a friend. She was a senior in school, Sandra. Um, People abroad who are dealing with cancer, they don't have the support system like we have in India. They don't have families like us. Small thing is, she was looking for somebody who could just provide her with meals at home because there came a time, God bless her soul, she passed away recently. There comes a time when you can't even get up out of bed. when it
Oh,
enters the terminal. I would like to share here, if you know somebody who is suffering, go talk to them, give them a little bit of your time. It'll improve you. It'll do wonders to you. It'll give you a perspective to life. Go there, seek out, keep them company, offer help. Go fetch the medicine also. That makes a whole lot of difference for a patient that there is someone who cares, who's not blood related. Do it. Go out. Seek people who have, give them help, offer them a smile. That's enough that we do into bettering their moments when they are passing through a rough period in their life.
so sweet. That is so beautiful. So before you guys give us your last, few tips for our viewers and seekers and inspire those who can help or who are, suffering from cancer themselves, I would like to say everybody that is joining us from Yashpal and Anita's side, please follow the Paradigm Shift page because we bring you inspiring stories of people who have done things to shift their paradigms to better themselves and the society. And everybody that is come here today from the Paradigm Shift, please follow Dr. Anita. We'll be putting their links down. And anybody who wants to speak to Yashpal about his journey and the work that he does, he's doing some amazing organic farming. We'll probably get him here another day to just do little talk about that, which was going to be very inspiring, and that is the need of the hour today. So please, follow these people. They're inspiring people. Anything, Anita, Yashpal, tell us any last words for people who are, for this interview, because if we go more than 60 minutes, then Instagram doesn't take it. So I want to finish before an hour. Anita.
Yeah, sure. I have one message to say. I really think that Yashpa has been a real sweetheart to turn up like last moment and agree to do this. Yashpa, it was like, my idea. I'm like, just bring him on board.
Yeah,
And Shiku,
really
I
good.
think for the fact that you've kind of decided you're going to do another episode with him, I really think Yashpal deserves, I don't know, blue label. I don't know what he likes, what his flavor is. See, it's got public, so you don't have a choice.
I'm looking forward to you returning back from New Zealand. You can get it for me from the duty free shop.
Hmm.
But no, thanks a lot. It's been really good. And Shiku, thanks for all that you're doing. It's really, really amazing how you turn up like twice a week, and it's brilliant. And your kids are also following you, so it obviously shows that you and Sajeev are really doing a great job because we are here, but I think it's really the next generation as well. And I like the fact that you bring in a lot of people in the younger generation as well, who are just so amazing. I mean, gosh, I listen to some of them and I'm like, okay, I don't even sound like that even now. They are so,
You're very
so
sorted
proud.
out.
Thank you. Yeah.
Yeah.
Thank you.
And so, thank you to Shekhu. You're doing a wonderful job. And every time I log on to first it's your Insta, now FB, I leave your show. Yes, a very subtle perspective for my friends and those of families and extended families. Anybody with cancer, believe me, you're beginning on a new journey of self-discovery. Take it as that. Detach yourself from the body. It's just the body. It needs some reworking. तो मरम्मत हो रही है. वो let it happen and let the body take care of you. You look after yourself. Look after your spiritual well-being. Look after your emotional well-being, and the body will heal it on its own.
So good. So Daisy says Yashpal has a lovely mango farm. So we are going to his farm in the next episode very soon. And Mona Rathor says, lovely talk, guys. She's the only one who's representing the other school. They're all going to get minus points because today it's CGM all the way.
Yes.
So thank you so much, Yashpal and Anita. You guys have really been so, I'm so happy and I appreciate this that you guys are coming here and sharing your journeys. Thank you so much. And we'll see you guys soon.
Thank you, Dipshika. It was loving catching up with Doctor.
Thanks. Same here, Yashpal.
Bye
Please call
bye.
me
Thank
Anita.
you. Bye.
Bye. See you guys.
Bye bye. Bye bye.